So we're here continuing to talk about the concept of relational motion. So one thing stays still, one thing moves in relation to the other. So when we're looking at soft tissues, we understand that depending on the soft tissue, whether it's a ligament, ligaments will attach from periosteum to periosteum. So from the periosteum of one bone to the periosteum of another bone, muscles will blend into tendinous units, and those tendinous units will then attach to the periosteum of a bone. So what we understand is that there's a relationship to the bone. So conceptually, if we think about a bone staying still, we can move a soft tissue in relation to it. If we think about a soft tissue staying still, we can move a bone in relation to it. So a relatively straightforward place to show this is the flexor compartment of the forearm. Right? So what we do, I'm just going to lift his arm up a little bit higher just so it sits more appropriately, is I can keep the radius and ulna still, and I can move the muscles of the flexor compartment in relation to it. Now, why do I go across fiber direction? The reason I go across fiber direction is I can only make a muscle a certain length here, right? So I can make it as long as it's capable of going in its intended fiber direction. But when we go across fiber direction, what we can also do is essentially create a bowing effect. We can create a C, or you can look at that different ways, you can term it different ways, but essentially we take a straight line and we put a curve in it. So if we make it as long as possible and we push across, then at least on one side what we've done is we've lengthened that tissue more than it normally would if it was just to contract on its own. So what I can do is I can again move the forearm compartment, or the flexor compartment of the forearm, all of that muscle mass in relation to the radius and ulna, or I can bind in one direction or the other. Okay? And I can move the radius and ulna in relation to the forearm, or the forearm flexors. So I can hold here, move the bones, right? The hand is moving more than the radius and ulna, so there's a bit of a visual kind of trick there. Or what I can do is keep the radius and ulna still, and I can move the soft tissues. So again, one thing stays still, the other thing moves. So forearm flexor stays still, or the flexor compartment stays still, bone moves in relation to it. Bones stay still, muscles move. There we go.